All right, Brad, this is a video by Dr. Eric Ekstrom.
Mhm.
He's a specialist in back, neck, and spine care.
And he's doing some very advanced treatments on these, and it's something you're going to want to know.
And check it out.
Yeah, check it out. Yeah, I was going to say something else, but just check it out.
Check it out.
Bob and Brad, the two most famous physical therapists on the internet.
Well, welcome back to the program, Dr. Ekstrom.
Hey, morning. Good to see you.
So today we're going to talk about Carson Daly's back procedure. So what procedure did he actually have done?
Carson had a procedure called Intracept. He had it at the bottom segment of his back. It's called L5S1. And if you watch the video, you hear the story specifically, but he had about a 25-year history of chronic low back pain. He got injured apparently in a snowmobile accident when he was working with MTV. And so since that time, he's been dealing with this back issue. He describes it as like he's wearing his pain every day. He tried all sorts of different treatments, from rehab options to interventions and so forth, and it didn't get better. And so his spine provider, Dr. Patel, she talked him into finally getting an MRI to try to get more information on what's going on. And he had some changes in his spine that made him a candidate for this Intracept procedure. So uh, specifically, he had these changes in his spine that suggest that the pain is not coming from the disc, and that's what we've historically treated all these decades. If you have a chronic low back pain problem, it's probably a bad disc. But what we discovered, and actually it was always there's like 30 years of basic sciences that says, well, the pain could probably not be coming from the disc, but from the bone on either side of the disc. And that's what we now call vertebrogenic pain, not disc pain. And so using that perspective and knowing the information that Dr. Patel had on Carson Daly, she chased this Intracept procedure on him. So maybe a couple things about why the pain would be coming from the bone. What happens is, we know that the disc breaks down, right? But there's this, let's say, border wall between the vertebral body and the disc. We call that the end plate. And when that disc breaks down, that end plate starts to break down along with it. And that causes a reaction into the bone or into the vertebral body. It's an inflammatory reaction in the beginning, and pain nerves get activated, pain nerves get produced. And then there's this mainline nerve called the basovertebral nerve. And that's what the Intracept procedure does. It treats that nerve, it basically burns it off. Disconnecting the phone line is kind of how I put it. And that's how you can hopefully then lose that back pain that you're having. So yeah, he underwent that Intracept procedure, and he did pretty good.
So you actually performed the Intracept procedure, correct?
Yeah, I was one of the early providers or adapters of Intracept. I started getting involved with a company. It's called Relievant, who helped evolve the literature behind it, and of course the procedure itself, Intracept. In 2019 is when I started my journey. And in fact, when I get done this morning, I get to go do 3 cases. Yeah, it's been quite a journey, and an exciting journey. I'm glad I got part of it. I'm glad to see the outcomes in these patients with this vertebrogenic pain.
So with this type of surgery, it's more minimalistic, right? So non-invasive.
Right. I mean, we still do it either at a surgical center or at a hospital. You're set up like a, pre-op, like a surgery. You can't eat, and you have to have a physical and all those sorts of things. The procedure itself is done under some kind of high-level anesthesia. I do mine under general anesthesia. to do a single level, it's probably going to take about a couple hours of your day to go through that process. Once we're done with the procedure, our average length of stay after the procedure is about 45 minutes. You go home, and we've had very little pain post procedure. People are staged up to go back to physical therapy usually afterwards. The procedure itself, you're on your belly. We make, for one level, you have to treat the bones on either side of that bad disc. So 2 small incisions, like the size of a baby aspirin or a pea, are made. You use a special needle, we call it an introducer, to go into the bone and eventually into the vertebral body. You create a very small little cavity that allows you to put a probe into kind of like the core of the vertebral body. That's where you're going to find most of that nerve. And then you burn it. And the cauterizing, we call it radio frequency, takes about 7 to 15 minutes per level. And then, of course, you removed all your probe and so forth. And, there's no hardware left. We don't alter the anatomy at all except for cauterizing that nerve. And, for those that are listening and you've had some experience with chronic low back pain and you've had some of these radio frequency procedures previously for other things in the spine, and you've heard those nerves can grow back, and that is true. But in this case, this particular nerve, the basal vertebral nerve with the BVN, is structured where it doesn't have what we call myelination. The bottom line is that nerve can't grow back. So the procedure is permanent. You don't have to come back and have it repeated. It's kind of a one and done thing.
So who would be appropriate to receive this type of procedure?
So it's a very specific criteria. And there's 3 things you have to have. The first is chronic low back pain greater than 6 months. And Carson Daly hit it for 25 years. Second thing is you've had to have failed conservative treatments. And that would be, the rehab options, chiropractic care, physical therapy, massage, all those things. Maybe you failed interventions and different injections and so forth. And then the last thing is you have to have an MRI in most cases, and it has to show what are called modic changes. And again, if you go back to that video on Carson, Dr. Patel actually does throw up his MRI and points those out, or you can Google it. And what modic changes represent are signal changes within the bone that represent those changes within the bone that I described earlier, where the end plate breaks down, and inflammatory reaction, those angry pain receptors get activated and produced. And the modic changes, again, represent that process occurring. In addition, if you go back and, again, look at the basic sciences again, modic changes highly correlate or connect up to people who have chronic low back pain and have failed treatments. So, that data is already there, too. So, again, 3 things. You have to have failed conservative treatment 6 months, chronic low back pain greater than 6 months, and on your MRI, you have to have these modic changes. And the specific levels that are treated are from L2, so up to the top of the lumbar spine, down to S1, or to the top of the sacrum. So those are the segments that Intracept is indicated to treat.
So if people are interested in Intracept or finding more information about you, where can they go?
A couple things. You can get on Intracept.com, and there's a physician finder on that site. And so you just type in, I believe, your zip code, and then you can find providers that do this procedure. I'm with Summit Orthopedics here in the Minneapolis-St. Paul area. If you get on Summit's site, summitortho.com, you can find me. And my team is listed there, and you can connect up with the phone numbers that are there. And otherwise, Google, and you can find me too.
Perfect. Is there anything else you want to add about this?
So again, I've done a lot of cases, and I've had great outcomes in the majority of patients. So what I like about Carson's video is, I mean, he's happy. I mean, the thing is, he's 60 to 70% better. And I like the fact that the successful Intracept patient is the one that the back pain is affecting the little things in life. You can't load the dishwasher. You can't, sit and play with your kids. You can't, one of my first patients was a nurse from Mayo, and she couldn't manage that car ride from Rochester up to Minneapolis. So he does a nice job getting that out there, that Intracept. I mean, it's not going to improve your marathon time, but it's going to help the little things in life that are getting in the way just to have good quality of life. And his expectation, he's happy with 60 to 70%. And we get more than that sometimes, and sometimes we get less. But I think he describes that very nicely in the video. And the other thing I like about the video is I learned what man paralysis was. Did you pick up on that?
No, I didn't watch this whole video. I've seen like little news articles about it.
Yeah, apparently they talk about that on the Today Show when they're interviewing Carson. And man paralysis is when men are tasked to do little things in life, like unloading the dishwasher or putting the toilet seat down. And anyway, I'd never heard man paralysis before, and God, my family's running with it now. So
I just call them chores, but okay,
Yeah.
it's good to know.
I guess there's a medical term.
Yeah.
Anyway, so yeah, that's what I got for you.
Perfect. Well, thank you for joining us today, and hopefully we'll have you back in the future.
Yeah, I always enjoy talking with you guys. You have a great rest of your day, okay?